Hey, welcome, y'all. If you don't mind writing in the chat where you're calling in from and what brought you here today, we'd love to know who's on the call with us. So actually, before we get started, I just want to say thank you for taking the time today to dig into such a difficult but important topic. And we thought before we kind of launch in officially, because this topic is so emotionally challenging, I just wanted to give us 30 seconds to really settle in and get grounded. So this is completely optional, but if you'd like, you can take a second right now to settle into your chair. Feel the weight of your feet on the floor, maybe do some shoulder or neck rolls. And then with your eyes closed or softened, take a few deep breaths in and out. And take a couple more on your own. All right, let's get started. So welcome, y'all. My name is Eileen McGinnis. I'm the founder of the Parents Climate Community. We're a nonprofit in Central Texas, and our mission is to engage more parents, families, and allies in local climate action. So ever since Simon & Schuster sent me a copy of Dr. Hendrickson's book, The Air They Breathe, last summer, I have been eager to press it into as many hands as possible. It's that important. So I'm so glad to be here today, hopefully connecting some new audiences with Dr. Hendrickson's work. So without further ado, let me turn things over to one of our partner organizations for our kids to introduce our speaker.
Thanks so much. My name is Wyann Sandler, and I'm the National Network Director of For Our Kids, which is a grassroots climate justice organization for parents, grandparents, and caregivers based in Canada. It's my great pleasure to introduce today our speaker, Dr. Debra Hendrickson. Dr. Hendrickson is a board-certified pediatrician in Reno, Nevada, the fastest warming city in the United States, and a mother of 3. She's the author of The Air They Breathe, a pediatrician on the front lines of climate change, published in July 2024 by Simon & Schuster. Among many career accomplishments, Dr. Hendrickson is also a clinical professor of pediatrics at the University of Nevada School of Medicine and a founding member of Nevada Clinicians for Climate Action. We're so pleased to be here with you today, Dr. Hendrickson.
Okay, so thank you all for coming, and thank you, Wyann, again for that introduction. As she said, I'm here to talk about the impact of climate change on children's health and the book I wrote about this topic, which was published by Simon & Schuster last summer. So I also want to thank them and Elizabeth Faneri as well for sponsoring and organizing this event. I wanted to say, see if this is gonna let me share here. There we go. So I wanted to just briefly summarize my objectives for today and what I hope to accomplish. First of all, I hope the lecture increases everyone's understanding of how climate change threatens children's health and why young children especially are uniquely vulnerable to environmental hazards caused by climate change. I hope that I help you apply this knowledge in your activism around this issue. I'm hoping to convey steps that you can take to protect your kids today, which are adaptations that we make to climate change, but also to help what we can do to help prevent a worse future by reducing our own greenhouse gas emissions, those in our communities, and preserving more sustainable cities and communities. And those two aspects of climate activism, adaptations and sustainability, those two types of steps we can take are summarized in a handout that we have available for everyone that'll be linked to the talk. And I hope we all leave inspired by being together and fighting for this issue and learning more about what we can do in these very discouraging times, especially here in the States. So as Wyann said, I live in Reno, Nevada, which is the fastest warming city in the United States. So it's not the hottest city in the US. That would be places like Phoenix or Miami or Las Vegas, but we're the place where temperatures are rising the fastest. So summer temperatures here have definitely climbed. When I first moved here 30 years ago, many people did not have air conditioning. I did not have air conditioning, but it's pretty much a necessity now. But the biggest impact we've seen here is wildfire smoke. So we're 10 miles from the California border. In that upper photo, the mountains there are the Sierra Nevada mountains. And as fires have ravaged the Sierra Nevadas and the coastal range in California over the last decade, we've had weeks and even months every summer and fall that looked like this lower photo, which was taken from approximately the same location. And that lower photo is the Carr and Mendocino complex fires in 2018. One of the stories I tell in the book is of a little boy named, who I call Liam in the book, who went outside during this smoke crisis. And even though he had no history of asthma or respiratory problems, ended up in the hospital for several days on oxygen. And his story is also interesting because his mom had been exposed to smoke in 2013 during her first trimester of pregnancy. And while it's impossible to know if that affected him, he had a number of issues that have been tied to smoke exposure in utero. He was born prematurely, very low birth weight. He had a congenital heart defect, and he had another congenital defect, and he had a learning disability. And so, one of the goals I had for the book was to explain how a case like Liam's could be linked to much bigger global issue, the much bigger global issue of climate change. And, as well as the minutia of how we live our lives every day. In that upper left photo in the city there, those buildings are being heated by gas-powered HVAC systems. They're getting their electricity from gas-powered power plants. Cars are driving through, airplanes are landing nearby. So tying that to the smoke crises we're experiencing and to the minutia of this one little boy's body and what was going on for him, webbing all these issues together was one of my main goals. But if you've read the book, you know that I also, one of the main goals I had was to really make a moral call to action, because I believe that climate change is a crime against children like Liam, and that it's now up to all of us to do what we can to address it. So how is his story tied to global processes? Well, ever since the dawn of the industrial age, when we first started burning coal for power, we've been pulling carbon from beneath the earth and transferring it into the atmosphere in the form of emissions from fossil fuels. This is a graph that shows how the concentration of CO2 in the atmosphere, which is of course the most important greenhouse gas, and the average surface temperature of Earth have changed over the last 2,000 years, which is the period in which modern civilization has developed. And as you can see, they parallel one another because CO2 prevents the sun's energy from escaping back into space. It traps heat near the planet's surface. And you can also see that we're living through unprecedented times. Our bodies and our civilization evolved in a certain set of conditions, this atmosphere and this climate, that are now rapidly changing. And that has huge repercussions for our health. And this graph was produced in 2022. We all know now 2024 was the hottest year ever recorded in human history. So, and this was not an accident. In 1977, an Exxon scientist named James Black warned Exxon executives that emissions from fossil fuels would, within a few decades, radically alter the Earth. And it was called, of course, the greenhouse effect at the time. It was not yet called climate change or global warming. And Exxon, to their credit, took his warning very seriously. They poured millions of dollars of research into confirming his findings, and very famously, in climate circles at least, produced this chart on the right that almost to 1/10 of a degree predicted exactly, what our temperature would be now and what atmospheric global carbon dioxide would be right now. So by the late 1980s, all the major oil companies had reached the same conclusion, yet they spent decades, as we all know, denying this science that they themselves had pioneered and obstructing any action to address it. So I say in the book, and I'm not the first to say this, that this is the greatest moral crisis humanity has ever faced, because this small group of powerful people decided over 40 years ago and repeatedly since to this day that this incredible burden that endangers civilization and every living thing on Earth would be passed on to the world's children, who have the least power of anyone. And I sum this up in the book by saying, all the children alive today and all who will ever live were chosen to bear this burden by the men who ruled the world. And the result we all know now is this increase in extreme weather events, wildfires, hurricanes, heat waves, floods, and droughts. And this is a satellite photo from 2017 that shows a string of hurricanes headed for the Gulf, as well as, swirling wildfire smoke over the West. And I think one of the reasons the fossil fuel industry has gotten away with their obstruction for so long is that climate change hasn't created a whole new unique type of event. These are disasters we've always known. Climate change is just turning up the dial on them, making them more severe and frequent. And what's interesting is that illnesses we've always known are doing the same. It's not creating entirely new categories or types of illness. It's just turning up the dial on diagnoses that doctors have seen for centuries. And this affects everyone, but it's created a really ironic situation in pediatrics because in many ways, this is the best time ever to be a child. In 1900, at the beginning of the 20th century, so not really that long ago, a newborn had only a 50-50 chance of reaching the age of 15 anywhere in the world. 40% of all deaths in the United States were children 5 and under, and that's now 2%. This is, of course, because of breathtaking medical advances, public health steps too, like clean drinking water, sewage treatment, milk pasteurization, but also things like vaccines, genetic therapies, new surgeries, insulin pumps, and glucose monitors, a whole huge range of modern medical technology. What goes unsaid and what we take for granted is that the survival rate that we take for granted among our children today is really the result of a functioning civilization. And all these systems that have developed to produce these results are now under threat. And so that's one of the hidden effects, I think, or hidden consequences of climate change that we have to think about when it comes to children's health. And another quote from the book summarizing this: we see now that modern life is built on slow, ironic poison. Today's doctors can save a baby with a malformed heart, but driving to the hospital speeds up, ever so minutely, the end of his world. So why have children always been a high-risk group, and why are they more at risk from climate change? I say in the book that while extreme weather is a risk to everyone, it is a crisis first and foremost for children. First of all, because obviously they're going to inherit the world we create. They're going to have more years in that world. They're already, I hope to show you today, being disproportionately harmed. Babies and toddlers, that under 5 group, are most at risk as they have been throughout history, partly because they have more life years ahead of them. And one group of researchers, when they looked at the impacts to that age group and the impact of that greater life years ahead of them, meaning, if you have an injury, for example, in utero that affects the formation of your heart, if you have an injury in early childhood that affects the development of your lungs, that's going to affect you for decades. So when they looked at that life years issue combined with how vulnerable children were, they concluded that almost 90% of the global health burden of climate change is falling on children under 5 years old. And kids are vulnerable partly because, as we say often in pediatrics, they are not just small adults. Their physiology, the way their body works, is actually quite different in ways that makes them more vulnerable. And I'll go into detail on that in a little bit. They're smaller, so the same dose of air pollution or heat for them is pound for pound greater than for an adult. Their behavior, immaturity, and dependence on adults puts them more at risk in certain ways. And maybe most importantly, their organs and body systems are still forming and growing and are vulnerable to disruption by environmental hazards. And I want to especially talk about this last point because, children's bodies and minds develop through interaction with the world. I go into a lot of detail in the book about how the lungs and brain literally form through interaction with the air they breathe, which is partly where the title comes from. Lung development is very badly affected by air pollution, as is the brain, we now know, which also, of course, forms through a child's experiences and relationships. And this also brings up one of the themes of the book, which is that children's bodies and all of our bodies are inextricably linked to the atmosphere. Every time we take a breath or drink water, we're pulling the atmosphere into our bodies, and every cell of the body contains oxygen and water. So we literally carry the atmosphere within us, but we never think about it. And I want to read an excerpt from the book that talks about this issue. So just to set it up, this is from the introduction, and it's after that car and Mendocino complex fire that left us covered in smoke for weeks and put Liam in the hospital. And shortly after that, the city of Paradise, California had burned down, and that's not too far from here. So we had a lot of refugees basically coming into the city to stay with family members. And shortly after that, the air had cleared. I was walking from my clinic into the hospital to see kids in the pediatric ward, and you have to pass through this glass hallway. So as you do that, there's a garden down below, and I looked down and I saw a little boy who I had just finished seeing in the clinic, and he was down there with his mom and his toddler brother. It was starting to rain, and he was trying to catch a raindrop on his tongue. And I used that scene to explain how his body and physiological processes were connected to everything else in the scene, that the atoms and molecules of water and air that were swirling around him might have flowed through him and many other living things around the world. And so this is just about a page. So, which meant that these elements were only borrowed from the atmosphere, not owned. That as he played, the breath he exhaled and the moisture evaporating from his skin, mouth, and lungs were rising back into the clouds to be carried away by the wind. That the water in the urine he voided that night before being tucked into bed would find its way eventually back to the sea. Because the water and air and heat that swirl around the globe in clouds and rivers and oceans and wind also flow through us and every living thing. The atmosphere outside the windows of the clinic and hospital, the backdrop to my patients' visits, is part of their bodies, physically linking them to this planet and all its life. Children are creatures of this world. What we do to the earth, we do to them. But children are attached to their world by more than water and air. When my young patient finally caught a raindrop, he threw his fists in the air and ran to his mother, who was sitting on a nearby bench. She smiled and hugged him, and he went limp with mock exhaustion, knowing she would not let him fall. The baby then squealed at being left out and waddled toward them like a tiny drunk. The older boy turned, crouched down, and tenderly hugged his brother, who had collapsed into his arms. "It's okay," I could see him saying. "It's okay." For a moment they were in a line, the mother's hands on her son's shoulders, him embracing his brother. Who could doubt, looking at them, that love passes through generations as surely as genes, linking us to everyone who came before and everyone who will follow? Who could doubt what science now proves and what I tell an audience of medical students every year when I lecture about early childhood? That the love we show our children, like the water they drink and the air they breathe, becomes part of their bodies, literally shaping their brains and hearts and futures. That same love, I hope, will save us, because it is the fiercest love that human beings feel, and no healthy parent, if they see their child is in danger, does nothing. So what health threats are increasing due to climate change? It's a long and complex list. I'm not going to go through all of it today, but just briefly, health infrastructure is being damaged and lost, and this is a concern for a lot of healthcare organizations. For example, in the Paradise fire that I mentioned, the Feather River Hospital closed during that fire and has never reopened. During Hurricane Helene in 2024, the plant that produced 60% of all the IV fluids for the United States was badly damaged, and there was an IV fluid shortage across the United States because of that. So those are just examples of how the healthcare system itself is being endangered. Air quality is being affected through wildfire smoke, increasing urban ozone, which is smog, and rising allergies. Heat illness is increasing as heat waves rise around the world. The trauma of natural disasters, abuse and neglect, conflict and migration, infectious diseases like fungal, water and foodborne diseases, zoonotic, which are, they come from animals like bats, and vector-borne illnesses like mosquito and tick-borne illnesses, food and water insecurity, and this applies to all of these, this is tied to all of these issues, the mental health impacts of these changes, anxiety, depression, grief, and PTSD. So because of time limits today, it's too much to talk about in one visit, but I touch upon most of these things in the book. I'm just going to talk today, with summer coming on, two things that almost everybody in the United States and Canada has experience with or will experience this summer are wildfire smoke and heat waves. And I think these are good examples too of why kids are more vulnerable. So increasing mega fires is one of the most significant impacts of climate change. This is a graph just showing California, the top 35 largest wildfires in California history. It doesn't even include 2021, which was a huge fire year out here. 17 of the 20 largest fires have occurred just since 2000. A mega fire is a fire over 100,000 acres. And you can see this was a rare event until recently, and now it's become a very common event. But smoke exposure is by far the greatest health impact of these fires. In 2023, there were 130 deaths from fire injury in the US. That was mostly due to the tragic, horrible fires in Maui, which killed over 100 people. So it was an unusually bad year. 8 firefighters were killed in Canada, which Canada, of course, experienced record-setting horrific wildfires in every province in 2023, with huge air quality impacts for the entire North American continent. But compared to those deaths, smoke exposure is thought to have killed more than 52,000 caused excess California deaths, more than 52,000 in the decade between 2008 and 2018. 1.5 million deaths a year globally, and 40% of all those deaths are again in that under 5-year age group, mostly in developing countries, mostly from respiratory illness. But if you look at the whole group, adults included, these deaths are due to respiratory illness, heart attacks, strokes, COPD, kidney disease, cancer, a long list of causes. So it's difficult when somebody comes into the hospital, of course, with a heart attack during a smoke event. You can't say in that one individual case, was that heart attack caused by the smoke event? But we know when we look at large groups of people who are exposed to smoke versus those who aren't, you see the rates of these things go up during smoke events. And on the right here, I have a picture of the Rim Fire, which is the fire that Liam's mom was exposed to when she was pregnant and what it did to downtown Reno. If you've read the book, The Story of Anna and her mom who came in during the Rim Fire, another little girl who was affected by wildfire smoke, this picture was taken on the day she came into my clinic, and Reno is somewhere in the northern part of that photo. So what pollutants are in wildfire smoke that we have to worry about? Well, there's 3 main categories. There's gases, particulate matter, and toxic chemicals and heavy metals. And the content varies a bit depending on what's burning. So for example, in big urban fires like the LA fires, there were heavier concentrations of toxic chemicals and heavy metals. But gases are a big problem. Ozone, which I mentioned, is rising because of climate change on its own in urban areas. That's smog that forms when temperatures are rising. It's catalyzed by warmer temperatures, so car emissions plus temperatures create ozone. But it turns out wildfires also produce a huge amount of ozone, and about 2,000 ER visits a year, pediatric ER visits in the Western US, are attributed to ozone pollution from wildfires. Though some of these gases also are greenhouse gases, so we're kind of in this unfortunate feedback loop where climate change is increasing the fires themselves are a source of greenhouse gases. In terms of public health, though, particulate matter is considered the biggest threat in the smoke, and it's often bound to some of these other elements in the smoke. And it's been the most extensively studied mostly in fossil fuel emissions. So particles, as I said, are the main threat in wildfire smoke. This is microscopic soot and droplets that are bound to heavy metals and toxic chemicals. The smaller the particle, the more invasive and dangerous to human health. And that's what this graphic is trying to show. You can see as the particles get smaller, they invade more of the body. And that's because they can penetrate through the lungs into the bloodstream and travel to any organ. The adverse effects they have are due mainly to the inflammation they cause. They cause both inflammation in the organ that they reach, but also systemic inflammation of the body that causes a cascade of problems. In children, they can also cause physical disruption of normal developmental pathways in the lung and brain, for example. And for a while, there was a debate about whether, because there'd been so much research on fossil fuel particles, there was some debate about were wildfire particles better, worse, and it turns out we have multiple lines of evidence now that wildfire particles are more inflammatory than fossil fuel particles. The exposure is different. If you're in a neighborhood with chronic fossil fuel pollution, you're being exposed daily for years. If you're in an area of the West that maybe only gets wildfires periodically and in between has very good air, it's a different type of exposure. So we're still sorting out the differences between them. But in general, we know that particles are very bad for human health. They're linked to many adverse effects in children. And I broke it up into 4 categories: respiratory illness and infection, perinatal complications, neurodevelopmental delays and disorders, and multiple organ and system impacts. So we know that asthma visits and hospitalizations go up in children during smoke events. Bronchiolitis, which, the most common cause of that is the RSV virus that you've probably heard of. Bronchiolitis goes up, hospitalizations go up and visits, COVID-19 cases go up, pneumonia, bronchitis, sinusitis, allergies. So all kinds of infections and illnesses rise when the particle level rises in a city. We know too that they stunt lung development function and the development of normal lung immunity. There are perinatal complications that I'll talk about in just a moment. We now know shockingly that there are a lot of neurodevelopmental delays and disorders being linked to particle pollution. And there are multiple organ and system impacts that I don't have time to go through today, but suffice to say that basically almost any health problem that people have looked at to see how it's influenced by particle pollution, they have found a connection and that particle pollution can increase the risk. Now, why are children more vulnerable to air pollutants like particles? I'm sorry. So first of all, like I mentioned, they have a different physiology. And one aspect of that is that they breathe faster. They also have a larger relative lung surface area. So pound for pound, they have more surface area than we do. And this means that they're exposed to more air pollution per pound of weight. They're closer to the ground where pollutants tend to settle. They play outside more, they tend to mouth breathe more. The linings of their airways are more easily damaged by particles, which then allows the particles to penetrate deeper in the body more easily. But as I've mentioned a couple of times now, one of the most important things is that their lungs are still developing and they therefore are more susceptible to injury. 80% of lung growth happens after birth. And this little diagram on the left shows that you're born with these little saccules that then become all the alveoli, which are the little, they look like clusters of grapes at the ends of the airways, where the gas exchange takes place, where you take in oxygen and exhale and transfer carbon dioxide into the lungs. So when particles pollution is a constant in a child's life, they can stunt the development of the lungs and alter lung immunity. We know that children who are chronically exposed to particle pollution, like in some of the most polluted neighborhoods of Los Angeles, are 5 times more likely to have significantly reduced lung capacity. And if those kids were moved into neighborhoods with cleaner air, they could recover 10 to 12% of their lung capacity if that happened before they reached adulthood. Now, particles harms start before birth, as I mentioned in Liam's case. That was one of my questions about what had happened to him. We now know that particles can inflame and cross the placenta. They trigger preterm birth, low birth weight, and certain congenital anomalies. They've been tied to them. Globally, 2.5 million preterm births a year are triggered by particle pollution, both fossil fuels and wildfires. The fetus is especially vulnerable, of course, because it's still forming. So prenatal exposure has been linked to congenital heart defects, to cleft lip and palate, gastroschisis, which is an abnormal formation of the abdominal wall, and impaired lung development. This figure here is pointing out particles within the placenta, and this was discovered in 2019. And we know the higher the concentration of particles in the air, the more particles in the mom's placenta. This is some of that research I was mentioning about children's brains. We now know that particles can injure children's brains through either direct invasion of the brain tissue or through systemic inflammation. A series of studies in Mexico City show that they can actually enter through the nose and ascend up the olfactory nerve into the prefrontal cortex, which is, of course, an area of the brain that's very important for thinking and behavior. They can also reach the brain through the blood, through the lungs or the mom's lungs into the bloodstream and into the brain. And just systemic inflammation, again, can affect neurodevelopment. So various cognitive and behavioral consequences have been tied to this. There have been multiple studies now tying particle pollution exposure, especially prenatally, to autism risks, to ADHD, and to later to dementia risk over the lifespan. Most brain growth, of course, happens before age 3, and this makes fetuses, babies, and toddlers especially vulnerable. So what can parents do to protect themselves this summer from these pollutants? And these, again, are adaptations we can take to things that are already going on. You can get the AQI app on your phone, the Air Quality Index app. You know, if the smoke is really bad, you can just look out your window and see that it's pretty bad, but sometimes it's a little more subtle than that, or if it's an ozone issue, it's not going to be as visible. So if it's over 100 kids are not supposed to be exercising outdoors, I would just say don't spend a lot of time outdoors. If it's over 150, they're not supposed to go outdoors. This is an actual screenshot of my neighborhood during the fires in 2021 here. So it can get quite bad. If you have an HVAC system that can support a good quality air filter, like a MERV 13 filter, MERV 13 or greater, that's something you want to get. Air purifiers like this one here, this is called the Co-Way. This will clear a large room of 99% of particles in a half hour. So we have many people in Reno have these. You can also make them at home from instructions you can get online. Air quality monitors are available. This is a company called Purple Air. They have an air monitors network that you can join for your neighborhood and your state. You can have indoor ones or on your person. Again, this is if you can afford it. Wearing an N95 mask or a damp cloth cover over the baby seat. In advance of fires, if you can weatherize your home, that is another step you can take. Now, we have a problem here in Reno, the low-income neighborhoods. You know, smoke is a pretty egalitarian impact. Everybody is affected. But if you have a poorly sealed home, if you don't have air conditioning, if you have a swamp cooler instead of an air conditioner, those pull the smoke directly into the air, so into the house. So lower income neighborhoods tend to be more impacted and struggle more with some of these adaptations. So the other impact I want to talk about was heat waves, which I know we were talking before we started about. Texas is already experiencing 100-degree days. Southern California has already as well. This graphic on the right shows that heat wave characteristics in the United States, you know, the frequency, the duration, you know, how many days the heat wave lasts, the season in which heat waves are occurring, and the intensity of heat waves, how high they're going. All of those things have been increasing in recent decades. I couldn't find a similar graph for Canada, but a recent article was showing that 37 heat waves that occurred in Canada last year were made 2 to 10 times more likely by climate change. And globally, over 90% of children born in 2020, a recent paper just showed, will face extreme heat in their lifetimes if emissions stay high. The two illnesses that the type of illnesses people tend to think about with heat are heat exhaustion and heat stroke. And it's important to know the symptoms of these. You know, heat exhaustion is just not feeling well, headache, fatigue, dizziness, your muscles might cramp, you might feel sick to your stomach. If your kids are showing these signs, you want to get, or if you're feeling them, you want to get to a cool environment as quickly as possible, to the shade or air conditioning, drink water, and rest. Because if it's untreated and you continue to remain, or especially if you exercise in heat, you could begin to suffer the symptoms of heat stroke. And heat stroke is a life-threatening emergency when you have minutes to respond and you need to respond quickly. The hallmark symptom of heat stroke is mental status changes, so confusion, seizures, you know, or maybe unconsciousness. So, and I tell the story in the book of a couple of boys in Phoenix who developed heat stroke while hiking. Then we go through this in great detail. There are two categories of kids we see often in the headlines with heat stroke. Nearly 1,000 infants and toddlers have died in the US since 1998 from vehicular heat stroke, from being forgotten in a car. Exertional heat stroke is heat stroke due to exercising on a hot day is the leading cause of preventable death in high school athletes. About 65 teenage athletes, mostly football players, have died since 2000 because of heat stroke. August is the deadliest month, and linebackers account for 86% of the cases. They tend to be more heavy kids. And football players are more at risk because the padding limits their ability to cool through sweating. So there's a lot of difficulty in tracking heat-related illness, similar to what I mentioned with smoke or air pollution. Heat stroke is usually obvious, but heat has more subtle effects on health that are often missed by patients and doctors. There are many different diagnoses and overall mortality that rises with temperature, and we can't know in any individual case often if the symptoms are due to heat. Pediatric ER visits, for example, have been shown to jump 17% in heat waves. And it's due to a whole variety of diagnoses. Heat exhaustion, yes, but also asthma, diabetes, epilepsy. Diabetics' blood sugar tends to go up. Epileptics tend to have more seizures. We see more kidney failure and dehydration. So a long list of things go up, vomiting and diarrhea, but also child abuse. And there's been several studies now that show that heat waves increase the risk of child maltreatment. The rates of adult mental health crises, domestic violence, and child abuse and neglect all go up. Again, it's that under 5 group that is most at risk. They have, they have a greater surface air volume, so surface area to the volume ratio. So if you put a baby in a hot car versus an adult, the baby, of course, heats up faster. They have a faster metabolism. They actually produce more heat per kilogram, even if it's not a hot day. So they have more heat they have to cope with, regardless of the temperature outside. But they have a lower blood volume and faster heart rate that make it harder for them to shunt that heat to the outside the way an adult would. Their sweat glands are smaller, they get activated more slowly, and they produce less than half the sweat of an adult. And they acclimate to hot weather more slowly. When we exercise in heat over time, gradually, our heart will get stronger and we'll sweat more efficiently. And of course, this is also the age group that's the highest risk group for abuse and neglect. Older children face different risks. By 4th to 6th grade, most kids cope well with heat, as well as adults, but they often lack judgment about the risks and may not recognize the symptoms, as was the case in the 2 boys I profiled from Phoenix who developed heat stroke. Heat, we also know, can impact sleep, cognition, and mood, and there are a number of studies now showing that it affects learning and behavior in school, especially in districts that don't have air conditioning or that have not historically been hot places, and so are being affected in seasons of the year when they normally wouldn't have experienced heat. Important for parents to know that some medications, such as ADHD stimulants, increase the risk of aware of that. One issue connected with both smoke and heat is that hotter, smokier summers mean less outdoor play. And we know from a lot of research now that being in nature is important for kids' physical and mental health and development, and that more time indoors on screens is going to increase their risk long-term of chronic health problems like obesity, diabetes, cardiovascular disease, and depression. So this is one of the hidden effects, the less direct effects of a more hostile outside environment. This photo on the left is a news story that was done on a study that showed that in Phoenix, the playground surfaces can reach 180 degrees. And so there's a researcher from Phoenix who I profiled in the book who's trying to pioneer or trying to push for places around the country and around the world to create playgrounds from natural materials rather than metal and plastic, and try to create environments that children can still play in on hot days. So advice for parents or adaptations you can take for heat: follow heat warnings. There's a website, last time I checked, it was still up, for the CDC and NOAA called heatrisk.gov that gives a county by county assessment of your risk for that day or that week and things coming up. Canada has public weather alerts at weather.gc.ca that do the same, have the same function. If you're outside, have the kids obviously drink a lot of water, take those shade or air conditioning breaks, know the signs of heat exhaustion, heat stroke, do errands or exercise in the morning, avoid the hottest part of the day, get a rear seat alarm in the car if you have a small child. Most car manufacturers have agreed to make these standard in cars going forward, but if you have an older car, you can buy an alarm that attaches to the seat and connects to an app on your phone. This will tell you if you've left weight in the back seat, that you need to, it'll go off so that you can go back and get the child. Talk to coaches about heat, especially football coaches. Encourage hydration, cooling tubs. And this is called a wet bulb globe device. I'm not endorsing this particular one, but it's a device that measures the overall heat risk from solar intensity, wind, humidity, and temperature. And so gives you a better assessment of the risks. Make sure coaches are not telling kids that going without water is a sign of toughness. Let them take those water breaks. There should be a cooling tub on the field to dunk the kids in if they get too hot. And they should follow the National Athletic Trainers Association's guidelines. And again, advocate for those natural playgrounds. If your school or your parks department is going to be building a new park or putting in a new playground, see if you can get one that will be usable in hot weather. So I just reviewed some of the science on wildfires and wildfire smoke and heat. Now I just want to transition into what that and the adaptations we can take. I want to transition now into what can we all do about this as parent and physician activists. And Michael Mann, who's a well-known climate scientist, often talks about both the urgency and the agency of this moment. The urgency is that we know we have to cut carbon dioxide emissions in half this decade to avoid, this is globally, to avoid the 1.5 degree warming threshold with no or limited overshoot. And some people believe we're already past that trend line. But we also have agency, because multiple analyses have shown, and I detailed one of these in the book, that this is technologically feasible. All the barriers are political. This is a political problem, not a technological problem. And I put the picture of the Titanic here because they saw the iceberg, they just didn't turn in time. They turned too late. And so it's a metaphor, analogy for what we're living through now. People often say, in terms of sustainability, in terms of this global problem and greenhouse gas emissions, what can I do? And I usually say, think of yourself as being in the center of a series of spheres, each representing a layer of community. The closer you are to the center, the more control we have. And just start with one action at the center, anything you can do, and move out. Talk to others about what you've done and why. And each action, I think, tends to beget another. It gives us a certain sense of empowerment to do more. You take an inventory of your own home, life, and community. Where does your electric power come from? What's your diet like? How does your diet contribute? How do you get around? How is your home heated and cooled? And then, take in all the individual actions you can, if you can afford them, or if you can access government programs to help you, choose your local utility's green option if your utility has one, or get rooftop solar. Switch to an electric car, or fly less, or drive less, use public transportation, reduce your meat and dairy consumption, compost, reduce plastic, weatherize your home, like I mentioned, use a heat pump instead of a standard HVAC system. There are multiple things you can do. And of course, at the bottom of the list, I put join, which all of you have already done, joining these organizations. It's that is one of the most important things, is joining together with other people. It both lifts our mood, it helps us share ideas and move on together as activists instead of sitting at home feeling terrible about this. So in addition to individual actions, you can take public action. The first step I usually tell people, learn about the place you live. Very few people really know even where does their electric power come from. One of the first things I did when I got interested in this issue was mapping out all the power plants in my state and where the power was coming from and what was fueling it. And learn about the regulations that are governing the adoption of green energy or more efficient energy in your community. And then you can go to various types of meetings to fight for clean energy and sustainable practices at either city or municipal councils, your county commissions, or whatever districts. I know Canada uses slightly different terms for counties are used some places, but there are other terms used to define these municipal districts in other areas. Public utility commissions are very, very important determinant of the greenhouse gas emissions from your area. These are the commissions that decide what electric power is going to be burning, what facilities are going to be built. School boards, are schools decarbonizing? Are they adopting electric school buses? What can you do to help them do that? Are they building natural playgrounds? and then state and provincial legislatures. So these are all fairly local things you can do. And I think it's important when you go to these meetings, tell your story or your child's story about how you got involved in this, why you're interested. We know facts don't always move people, but emotions and stories often do, which has a lot to do with why I structured the book the way I did around stories like Liam's. And then focus not just on the bad things that are going to happen, but on the future we want for them. The last chapter of the book is called The Possible World, because I think it's really important to keep in mind the world we could have. Climate change is the greatest health threat, but also the greatest health opportunity of the 21st century, because fossil fuels, even if they weren't causing climate change, cause so many health problems. We could have cities without air pollution that are designed to improve public health and social contact between people. One example is what Paris has done. They've reduced air pollution within the city 40% in the last decade by creating all these big public areas where people bike and walk and talk instead of having cars in those areas. On the positive side, renewables are being implemented at a much faster pace than predicted, especially solar and batteries are exploding, particularly in China, which is racing ahead of the rest of the world. But of course, we have a number of new challenges. AI and data centers, the demand for electricity is surging, renewables are surging, but emissions are not falling because those renewables are not replacing the fossil fuel burning facilities that we have. We have a very hostile US federal administration now, and there's the issue of plastic pollution, which is another related threat. So one of the lines I have in the book is that the only heroes our children have are us. I think that parents are the sleeping giant of the climate fight. Many don't yet realize that slashing fossil fuel emissions is vital to their children's health. We can turn our grief, anxiety, and despair over this into anger, constructive anger, joy, and action in fighting for kids. Every action matters, every bit of warming matters, every year matters, and every choice matters, according to the Intergovernmental Panel on Climate Change. And I agree. So thank you. I'm sorry that ran a little bit over, and this is a drawing from the book that was done by a little girl who survived the Tubbs fire. So I just wanted to put that in there too.
Beautiful. Thank you so much, Dr. Hendrickson. There's been lots of very supportive notes in the comments, as well as a lot of questions. I just want to remind folks to upvote questions that are in the Q&A so that we make sure with just a few minutes that we get to the questions you all really want to get answered. If it's okay, I'll just jump in really quickly with a couple questions from the chat while they're in mind. There were just a couple practical questions around some of the content you talked about. So one question to do with heat was, is there a temperature that you recommend babies and toddlers to be kept inside for?
Yeah, that's a tough one because it depends on a number of factors. But I usually, if it's over 90 little kids, I would be very cautious, and try to do your errand. If the peak temperature for the day is going to be over 90, just try to do your errands in the morning and avoid a lot of time in the car and make sure they're well hydrated. There are tables that try to put together all these other factors like humidity, and the overall heat index. So it's hard to come up with a concrete rule of thumb, but over 90, but especially over 95, I would be super cautious.
And then one other question sort of that came up in the Q&A was around purple air quality monitors that they have in a city in Ottawa close to a highway. And I think the question was, okay, the air quality, these monitors say the air quality is good, but I'm a little bit skeptical. Is there another method to see if the air quality is in fact safe for our kiddos here?
The purple air system is probably the most finely detailed because it can be in homes, and anybody can buy one and put it anywhere they want. The government has fewer monitoring stations, and so they tend to be less detailed about your own neighborhood and your own house. I'm not aware of any more detailed monitoring systems than purple air. I don't know if anybody else knows of any. But that's a pretty interesting network to sign on to because a lot of people have bought them, and so you can get pretty good. Was this person, they said it was a purple air system, not a government station? Okay.
Great. Okay. sorry, I'm missing some of the questions, but one I wanted to, the one that just popped up, I know, because I think that another question that I sort of in the chat, as you were talking, as the chat was unfolding, was about kind of connecting, like this is such powerful information that we just want more people to know about, right? And so one question from Will has been, what have you found to be the most successful way to talk to other parents who may or may not be concerned about climate change? We have a very supportive, interested audience here today. So how do we kind of share this information, and what's been an effective method to talk to other parents about why climate action is so important?
I find that during certain events or certain times of year, there's better receptiveness. So like during the spring and summer, when people are anticipating these things coming, or when we're having a smoke event or a heat wave, it comes up naturally in conversation in the clinic. And then I usually think that asking questions of people rather than trying to lecture or give facts works better. Like, what do you think's going on? Or what do you think, and then we have brochures in our clinic that we can give people who express interest. And I have some of them like on the back of the door so that people can see them while they're waiting for me to come in. And so that sometimes will naturally spark interest. But, it's tough if people are really dug in and resistant and denying. There's usually not a lot of point in saying too much. You could just ask them questions about why they think that, or what do they think's going on. And, sometimes I ask people to think about, when you walk down the street now, when you take your baby for a walk in the stroller, all of us have to breathe in the exhaust of the cars passing us by. But imagine a world where none of the cars had exhaust, where we could walk through the city and or when COVID-19, when the lockdowns happened, one of the few silver linings was that you could see what cities would be like without any air pollution. And just realizing that that's a benefit. Even if you don't believe in climate change, the air quality benefits of getting off these fuels, like why do we support these fuels that cause so many health problems, even if you don't believe that they're warming the world, they can really help children's health. Most people support air pollution reduction and recognize the impact on kids' health.
One last question, or maybe we'll have time for a couple more, is about health equity. I know that's something that you talk about in great detail in the book, something that you also lecture on or teach on. And I'm curious about kind of how, if you could talk briefly about how that plays a role. And I will say for us here in the United States context right now, it's really challenging when even terms like equity aren't, are sort of being questioned. If we can use those words, how do we kind of move forward with really putting health equity for kids front and center?
Yeah, and I should have said more about that in the heat section. It was just getting too long. But yeah, here in Reno, there was a study that came out, I think last year, that showed there's a 20-degree difference on the hot days of the year. There's a 20-degree difference between the lower income neighborhoods and the better off neighborhoods of Reno. In Maricopa County, which is Phoenix, they've seen that heat mortality is much higher in those low income areas. So equity is a huge issue. But the natural playgrounds movement is partly about that, trying to address that and trying to plant trees. Trees and natural playgrounds are things that you can talk about that just improve the quality of life. You don't have to talk about equity at all. It's just and there's the studies that do show that having trees in your neighborhood lower certain health problems, cool the neighborhood, make people feel better about the place they live. They just create a lot of mental health benefits. So tree planting, natural health playgrounds, those are approaches you can take that don't necessarily have to raise the issue of equity, but just trying to improve those areas.
Mm-hmm. I love that example of the natural playground movement too, because it also gets at another question, which is we're telling kids to go indoors for safety reasons, but we also need them outside. And so kind of how do we find that balance moving forward? One last question, if we have just one more minute, there's a question, again, just moving from kind of adaptation to advocacy, which is what, in your opinion, are some of the most successful children's climate and health campaigns out there?
Well, I think the kinds of things you guys are doing, forming groups of parents who are becoming informed and, trying to become advocates in the public sphere about this and inform other parents. Moms Clean Air Force is another one. Of course, that's a big one. And then some of the just general climate groups like Citizens Climate Lobby. Third Act is a great group, which is for grandparents, not parents, but people over 65 who are interested in this issue. And one of the advantages of joining any of these groups, you know, physicians have formed groups in every state also, or almost every state, that look at these issues from a health perspective, and they are active in lobbying. But the main advantage, I think, of belonging to these groups is being alerted to issues that are going on in your city council, your county commission, your state or provincial legislature, that you can go down and become involved in. Because a lot of these organizations monitor the agendas of the different levels of government and what's happening that you can respond to. So because it's hard for any one person to keep up on everything. But you know, so any group that you join, stay involved in, and that's keeping you informed is a good one.
Well, I feel like that's a perfect segue to just let y'all know that we're going to drop in the chat links to all of the partner organizations that have supported today. So our organization, the Parents Climate Community, For Our Kids in Canada, Climate Families New York City, Families for a Livable Climate, and the Logan Community Clean Air Coalition in the Boston area. I will say, if you're not connected, you're calling in from an area outside of our range, we'll also link you to Our Kids Climate, which is a global community for climate parents, and you can very likely find a group to connect with on their site. We're also, I know people have asked about a recording, so we will share a recording with participants. We'll share all of the links that are posted in the chat. But just want to say again, a huge thank you to Dr. Hendrickson for taking the time to educate us and share resources from the book, and also to Simon and Schuster for hosting this event.
Is there time for one more comment?
Oh, please.
Yeah, I just wanted to say one other thing that links both your comment about outdoor play and how to reach parents who are resistant is talking about things, shared values, things we all remember. You know, we all grew up being able to play outside in the summer, go camping, go fishing, play soccer, whatever. We want those experiences for our kids. And that, you know, if you can connect to those shared experiences, everybody loves the outdoor areas near their homes. That doesn't have a political affiliation. So sometimes connecting over that can also be helpful.
Yeah, I think that's a great suggestion. And I also feel like that's the power that we have in kind of a parent-led climate movement, right? That we're sort of connecting around a shared love of our children. And that can be a really unifying message too.
Absolutely. Because yeah, that doesn't know a party affiliation.
That's right. All right. Well, thank you so much again, Dr. Hendrickson, and to everyone who joined in today. Really grateful for your time and for this conversation.
Thank you very much to all of you. Yeah.
Take care, y'all.